Morning Blend out live at El Conquistador Resort.
Well, a nice little short break there brought to you by El Conquistador, of course, limited commercial interruption for today's show. And here are Heather and I being eye healthy with our sunglasses here in the sun.
Which is everything, right? I didn't do this as a child. Now I'm doing it as an adult, and I'm trying to make up for it. And we're talking about vision today because we have the doctor in the house talking about childhood vision, because there are some things that parents may not realize. Because if your child is struggling with learning new information, it may have to do with their eyes, and it could be either problems with attention deficit disorder, problems with anxiety that you're possibly seeing, but there could be help for your child with the sensory learning program.
Right, and here with us now is Dr. Amy Thomas from Arizona Vision Therapy Center to tell us more about this novel approach with both organizing and calming the brain at the same time. Such a pleasure to have you sitting down with us.
Thank you. All right, I have a lot to talk about, so I actually have the notes today.
Let's hear it.
All right, so what it is, the sensory learning program was actually developed about 30 years ago, and it was developed by this lady that had an autistic child that was trying to get all of the senses to make sense, to match. But she started to realize that it works really, really well with anxiety. It works really well with learning new things, that type of thing. So she brought this new technology to, well, it started in California and went to Colorado. We brought it to Tucson last year, and we've been having some really good success with it.
So, and you're making some changes to the program now, right? Is that coming up this summer?
Yes, it is. Oh my gosh. Okay, so usually we do just the sensory learning program where they do get some really good benefits out of it. But this summer we've actually gathered a village together of people who come from other offices who like to work with children and to make sure that they have the best mind, body, emotions, everything put together. Actually,
it all connects.
It all connects, yeah. So I'm going to go through the ones that are going to be coming in on top of the sensory learning program. Okay, all right. So first one we have, so Geraldine's coming in with emotional release healing. So a lot of times children end up, something happens to them when they're really little. Say, for instance, we had this one girl who had been lost at the zoo for a half hour. She panicked. She had a whole bunch of abandonment issues after that. Geraldine is going to go in and she's going to end up helping this girl learn how to make wiser decisions that aren't based on the fear of abandonment type of thing. We have reflex integration that I get to work with. So during the milestones, when you first learn how to use your body, that's where you learn how to be graceful, how to do sports well, handwriting, that type of thing. And you also develop your vision. So I'm going to help develop that from the motor side. And then also Karen's going to be coming in with something called structural energetic therapy. And she's going to be laying the child down on this massage table and very gently moving the bones of their skull and their spine just to make sure everything's in alignment. And it helps with the cerebral spinal fluid so it flows through and it brings in nutrients, takes away waste products. And then we got some really good extra ones. Great Plains Laboratory was able to donate us some urinalysis kits. So we can actually do a nutrient panel on these children to see if they're low on certain nutrients or if they're having problems with waste product removal. And we have an ionic foot bath to help remove toxins on site. And we also have far infrared therapy to help improve circulation. This is so
I think
exciting.
You've covered all the bases.
Yeah, I would say so. From top to bottom, certainly.
All of this, it's worth $1,500 that everybody in here donated.
There's got to be improvements that you see in these patients after they leave, right? Talk about what you see after they've gone through this.
Okay. So I'm going to go through also some of the things that have happened just in the about year and a half at our office. These are some information and feedback I got from the parents. A lot of them are really happy that their child was able to take in new information. So they ended up having better social etiquette.
Which is always
Manners
for some reason. They were able to gather their thoughts more quickly. So just getting ready for school in the morning, it wasn't as tragic, it wasn't as chaotic.
Tragic's a good word. That's what it was like for me when I was growing up.
No, it can be an absolute tornado nightmare in the morning when you're trying to get a child ready for school.
Yep, and now these children have the ability to plan what they're going to do and put things in the right place at the right time. They have some had better ability to write essays because they could gather their thoughts that way. A lot of them came out with the ability to calm themselves down a lot easier, so a lot less emotional outbursts. And a lot of parents were really happy that their children were able to hold conversations with others. They were able to bring the right words out at the right time without losing any confidence in it. And it's just, there's so many other things. I don't think we have time for it, though.
We have a couple minutes left. If you have more feedback you wanted to share. But, I wanted to just discuss, too. I mean, the fact is that regular eye doctors, and I always like to hit on this because people go to these regular eye doctors, they don't check for these types of issues and these types of problems. That's why you go to a specialist, right? Because you guys have these specialized treatments and also the tests.
Yes.
Talk about some of the tests that you can do.
Oh, okay. Just to get in for the sensory learning program itself, we check the ability to attend to visual information way out here. Even though you have the ability to see movement out here, to be able to pay attention and understand that it's useful information instead of squirrel type of thing.
Right.
We've got the auditory screening to make sure that there aren't certain frequencies that are too irritating to the child or that they can't hear at all. We have all kinds of things with the reflexes to make sure that they're going to be coordinated. There's so many different things. And then I also, if we run across a lot of vision problems, I have the ability to prescribe the neuro-optics lenses, the ones that help stimulate and calm down.
The ones that are slightly blue. Right?
Yeah, those are,
Yeah, and it's so important to catch some of these things early.
Yes, thank you.
So, and different types of therapies you guys do, I've never even heard of before.
It's so true, and the fact is, parents and grandparents, if they see these issues in their kids, there's actually a little checklist that's on your website, right? A little report scorecard, they call it.
Yes.
That parents and grandparents can go download because you have to nip it in the bud, as we were saying.
Yep. One quick thing about the sensory learning program itself. Okay, the program itself is 12 days in office, 18 days home support. So it's extremely quick when it comes to therapies.
That's
I didn't want to forget that
families.
one. Thank you.
Doctor, thanks so much. And again, Arizona Vision Therapy is offering a sensory learning program at no extra charge. You can call them at 520-886-8800 to make an appointment, and you can also visit them at azvisiontherapy.com for more information.